I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have back with me again Ley Linder.
It's a pleasure to be here. Thanks for having me again.
Glad you're here, Ley. And we're going to talk about this neat approach we've been working through regarding evaluating changes in behavior or challenging behaviors that we see sometimes in people with intellectual and developmental disabilities. And it's really related to a project that we've kind of called Unlocking Behaviors, or an article series. Mm-hmm. So I'm going to let you start off about talking about what it is and the purpose of it.
I guess the best way to summarize it is it was a collaboration that was kind of the brainchild of Dr. Rader.
Yep.
And kind of brought us together with the idea that I think that there had been ongoing conversations with you and him, and then him and myself, that were overlapping, and the idea of having a physician and a behavior analyst kind of give their points of view in regards to the presentation of behavioral issues.
You know, the foundation of that really is what we call integrated healthcare.
Absolutely.
That benefits everyone. All of us can benefit from having our medical care integrated with our mental health care, integrated with our oral health care. Really, I mean, it's all connected, right?
Absolutely.
And I know from my experience in practice that so many times there are really important connections that not always are not that easy to see, but there are really big connections related to what we might consider or think of as maybe it's a mental health condition because they have these adverse behaviors and we need to control these behaviors. But there's a big connection to some sort of underlying medical condition that we might see. And we as clinicians don't always receive that training to connect those dots, and that's kind of why we're doing what we're doing.
Absolutely. I think that whenever we're working together to write these, I think we're both writing them from the standpoint of trying to share the knowledge to educate, whether it's a parent or a caregiver or a direct support professional, someone to try to take the information that we have and the knowledge we have to educate them. Because I know that when I went through to getting my formal training in behavioral analysis, the notion of think medical first was always discussed, but no one ever actually told me what that meant.
Well, you know, that's funny too, because from the other side, from the medical side, people will say, oh, you've got to rule out the medical things first. And that's obviously very important, but what sometimes happens is the person who's having some challenging behaviors might be taken to a clinician to have an evaluation to rule out medical causes. However, that clinician, just as I was when I started early in my career, may not really know exactly what to look for. And so that's kind of what we do and what we talk about and some of the approaches that we have in this article series. And by the way, this is an article series that we call Unlocking Behaviors, and you can find it in the Helen Journal. But again, we look at these challenging behaviors as a team, as a medical professional and a behavioral professional, and try to figure out what might be causing these behaviors.
And I think that in the space of the series, I know that when I'm writing the behavioral dynamic, I'm trying to convey that it's not just a physician or a behavior analyst. It's a nurse. It's an OT speech.
Right.
So OT speech, physical therapy, whatever it may be. It truly is interdisciplinary, and it has to be, because the interconnected dynamic. I get asked a lot of times, sometimes by nurses more commonly, Ley, why are you messing in my lane? Well, you shouldn't be over here. And the reality is, it's all one lane. And we should all be in it together, because you can't solve some of these behavioral presentations if I don't have help from a nurse or don't have the insight of a speech therapist who's an expert in swallowing, where the behaviors I'm seeing are spitting on the floor. Well, that's related to the exacerbation of GERD or issues with pocketing food. I need the expertise of a SLP to guide me through what these behaviors actually mean.
I think that's such an important point in it's really everybody's lane. And, you know, sometimes I think clinicians may not feel that maybe a direct support professional has a lot to contribute because they don't have a lot of training in any of these areas. But that's quite the opposite, because many times the direct support professionals, they may not know the medical terminology or their behavioral language or exactly what's going on, but they know that person and they know that person's behavior, and they can tell if there's a change in that behavior. And that type of information is hugely important for everyone and the whole team to be able to evaluate what might be going on, and we need that information.
Absolutely. I say all the time that direct support professionals, when I'm doing assessments and doing observations, they are the experts. I may have gotten a couple of letters behind my name along the way, but they're the experts in these individuals. And I first saw it on a New York City subway, but there was like a marketing campaign, I think post 9/11, that says, if you see something, say something. And it's really what I think about in regards to direct support professionals or caregivers or family members is they really do have the keys to unlock these behaviors. They just don't necessarily know what the information means. And their observational skills, getting that information from what they're seeing day to day out of them and onto the proverbial table, so to speak, so that we can then organize them and unlock these behaviors. They are the key very frequently to understanding this.
And I think it's on the healthcare providers sometimes to know what questions to ask to get the information that you need, rather than just assuming, oh, this person doesn't understand the language, they can't provide anything helpful. Sometimes we just need to know which questions to ask to get those insights. A great example would be, well, in what settings does this particular behavior occur? And we won't know that because we're not in every setting with that person, but that direct support professional will know that.
Absolutely.
And you can ask those specific questions. Say, when do you see this? When does it occur? Is it certain times of the day? Is it in certain environments? And all of those are clues that can help you figure out exactly what might be going on.
Absolutely, and particularly with direct support professionals, in theory, there's multiple of them, as opposed to a caregiver, there's usually one or two primary ones. You could say, well, does this happen with all of the staff? All of the direct support professionals? That would give you a clue. Is this going to be an interpersonal issue that's going on? And that's an important component to behavior too. If someone's interaction with you is different than me, then it may be something that we're doing that's eliciting the behavior, as opposed to a medical issue is more likely to be across all settings, all people, all time. And those are important questions, but I think this goes back to the fundamental dynamic of how do you think medical? How do you use behaviors to rule out medical issues?
And that to me really comes from education and experience, but education to start with. As I mentioned earlier, sometimes a person might be referred to their family doctor to be evaluated for a medical underlying cause. And I can tell you, early in my career, if someone were referred to me for that, I really wouldn't have known exactly where I needed to start or what I needed to look for. But you learn those things over time, and then you can teach those. And that's why education is so important. None of us are trained to do, none of us know how to do things without receiving some training on it.
Absolutely.
I always say this, if you came to see me for a cataract surgery, I'm not an eye doctor, you would go blind because I wouldn't know what to do, or I would refuse to see you, which would be appropriate because I don't know what to do, or I would expect a bad outcome. But if I were trained to do it, then I'd probably do a pretty decent job. And that's why training and education is so important. And what we're doing through this article series, Unlocking Behavior, is in a way providing some training and some education.
Absolutely. And I think that I know conversations we've had ongoing with each other have kind of gone on this dynamic of, getting it, so to speak. And I think that there's got to be an openness and a willingness to receive the information, to say, hey, there's a different way to look at this. It's not always the same, and that the training that we all received really can be looked at as just being foundational training. Because as we've said on several occasions, no one is teaching this in fundamental classrooms or fundamental classes that we're taking. So it is a lifelong education as clinicians and providers that we have to be open and willing to continue to learn and learn something different. Because what we're talking about does require a willingness to say, I didn't know that. I didn't know that
And,
that's what
and
it
it's
meant.
not just medical doctors or dentists, but I would bet
Behavior analysts,
behavior
for sure.
analysts aren't maybe receiving that type of training related specifically to how certain behaviors might appear or what they might indicate in a person with an intellectual disability. Is that
Absolutely.
fair?
I didn't have one single moment of formal education and behavioral analysis that was related to medical issues or healthcare. It was all about skill acquisition, discrete trial training, children, and I don't work with children. I work with adults, and primarily aging adults. So even within my scope of practice, I did not get any formal training in anything that we do together.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisk.com to learn more about how you can employ these tools with people you support. So just to kind of summarize here what we're talking about, we, both of us, I don't think, we can't stress enough the importance of an integrated approach to addressing and supporting the healthcare needs of people with intellectual and developmental disabilities, because so many things are tied to both, behaviors, mental health conditions, physical health conditions. Our physical health conditions affect our mental health, and so all of those things are so interrelated. And I would just personally encourage everyone out there to learn more about this, to improve their knowledge, to get more experience in this. And one way you can start to do that is looking at the Unlocking Behaviors article series. We've got a number of them out there, and there's some interesting topics. Let's just leave it at that. So if that whets your appetite just a little bit, you can find it by looking for the Helen Journal of Human Exceptionality. You can find that online, or look up Unlocking Behaviors, Helen Journal, and you'll find a number of articles that I think will be very interesting to you. And reach out to us and let us know if you have any topic suggestions as well. Lee, thanks for talking with me today about this. The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.